Now we move to the correct hand hygiene technique. Recommendations for routine hand hygiene technique vary according to the formulation being used, with major differences between alcohol-based hand rub and foam hand rubbing and hand washing with soap and water. Surgical hand hygiene technique is a different technique again, and we will look at this in the next section. Regardless of which formulation is being used, the manufacturer's instructions for use must always be followed. Otherwise, you cannot guarantee your hand hygiene will be effective. Waterless hand hygiene. When waterless hand hygiene solutions are being used, it is important that enough solution is applied to cover the entire palm. The number of applications needed to ensure the correct amount varies according to the volume dispensed with each dose and the size of the user's hand. Once sufficient product has been applied, users should rub their hands together, ensuring that all surfaces of the hands and fingers are covered. This procedure takes between 20 to 30 seconds to complete. Rubbing should be performed until the hands are dry. Detailed illustration of this technique is available in the World Health Organization guidelines on hand hygiene. Rub your hands together to cover your entire palms. Don't forget the sides of your hand as well. Place your left hand over the back of your right hand and interlace your fingers and rub and clean. You are trying to clean right between your fingers in all the cracks and crevices, and up and down the inside of your fingers. As well, you are aiming to thoroughly clean the back of your hand. Then, place your right hand over the back of your left hand and repeat this procedure. Now, reverse and do the insides. Place your palms together, interlace your fingers, and clean both your palms and between your fingers from the inside. Once again, you're trying to get right in the cracks and crevices between your fingers, as well as ensuring your palms are well cleaned. Now, lock your hands together using your fingers to ensure your palms are opposite to each other. Clean the ends of your fingers and nails really well, making sure the fluid really reaches into the crevices. Now for your thumbs. Grasp your thumb with the four fingers of the opposite hand and clean the thumb you have grabbed really well in a twisting motion. Then do the same on the other hand. You need to completely clean all surfaces of your thumb down to and including your wrist. Once you have done that and you feel as if you are really getting your hands clean, you now need to rub in a circular manner with your clasped fingers into the palm of your hand. Make sure you do this with both hands. Clean fingertips are essential for hand hygiene. When your hands are dry of all alcohol-based hand rub, and you are satisfied you have completed the hand rub correctly, your hands should be safe.